Picture this. You and your best friend are enjoying yourselves, happy as clams, going on about your merry way, when suddenly your friend collapses. He falls. It's dramatic, it's tragic. He hits the ground. He doesn't appear to be breathing. What are you going to do in this situation? Hopefully, I would like to assume that you would like to help your friend out. And luckily, I can teach you how to do these things because I happen to be registered and certified in CPR. Now this is how you accurately administer CPR. It's important to keep a few key points in mind. For instance, make sure the scene is safe, know how to effectively manage the situation, and then begin the actual procedure of CPR. With that being said, now we can begin. Before running wildly into a situation to save a fallen victim, it's important that you look around at the scene, survey it for safety, and make sure there's nothing in the area that can cause you harm. There could be fires, fallen poles with electricity, weakened structures on the verge of collapsing on top of you. I mean, who knows? The American Red Cross would like to remind all rescuers that there's any number of possibilities when it comes to dangers, and they should always keep their safety in mind. Keep in mind, you're of no help to a victim if the scene isn't safe. There's no telling what could happen to you in that dangerous situation, so you're much better off waiting on professionals to get there who know exactly what to do. You've surveyed the scene, and the scene is safe. But before you actually begin CPR, there's still a few more things you need to do first. Always wear protective gear if it's available. Your protective gear, like your gloves or a breathing barrier like this one, are great at protecting you from diseases. There's a chance you could come into contact with a disease by giving mouth-to-mouth CPR or by helping a bleeding patient. The Worcester Polytechnic Institute says that you should always take precautions because of how easy it actually is to contract a bloodborne pathogen, like AIDS or AIDS. Also, always remember to ask for consent to make sure the victim needs or even wants your help. This can protect you from lawsuits later on if the person wasn't happy with how you did. Are you okay? Do you need my help? Are you okay? If the victim is unable to give you consent, then ask a friend, a significant other. If they're alone, then you can assume that they need your help. Now you need to call 911 or EMS to make sure that help is on the way. So you have a safe scene, you've managed the situation, now it's time to actually begin CPR. To show you CPR, I'll be using this dummy. For our sake, we can call him Tommy. Check the victim's pulse by placing 2 fingers just below the jawbone. Since our victim had no pulse, we'll begin chest compressions to get his heart to pump blood through his body. To do so, we'll place one hand like this, like our fingers through it, like this. Put the heel of our palm in between his chest. Make sure you keep your arms extended, and then proceed to give the victim 30 compressions. You can go to the beat of the song, Staying Alive. Just make sure the chest fully recovers from each compression. 1, 2, 28, 29, 30. Now you'll need to tilt back the head and give the victim 2 breaths to help get oxygen to the body. For an adult, you'll want to give 2 full breaths. For a child, 2 medium-sized breaths, and for an infant, just 2 little puffs of air. Make sure your seal is tight. Tilt back the head. You'll need to make sure that the victim's chest rises and sinks. Repeat this process until you see signs of life, an AED arrives, EMS arrives, the scene becomes unsafe, or you're just too tired to continue. You made sure the scene was safe, put on protective gear, asked for consent, called EMS, and gave CPR with 30 chest compressions and 2 breaths. You now know how to do CPR the right way. I hope now you're confident enough to give somebody CPR if they need it. I'm sure your poor friend who collapsed earlier would be so grateful for it. Unless he dies, which could happen, he probably wouldn't be grateful, but at least you did all you could.